following up from our last episode where we released a live chat, but we're going to make some slight alterations and see if this one goes live. If you saw the last one, a lot of errors, a lot of playing around. So welcome everybody, it's me, Dr. Khaled Sadek, and you've tuned in to a random live chat meeting. I'm not wearing uniform because it's totally unscheduled, and really what I'm doing is a pilot run on all the equipment that we've set up today. So we want to see if it all works. In the last episode, we did a virtual clinic, and we tried to play all of our videos all at once. Didn't quite work as planned. So what I thought I'd do today is do a rerun, and let's try it all over again. I'm not sure if anybody's watching, but at least I can go back, watch it, make some edits, work out the best positions to have all the videos and all the animations that we need, including things like the chat box and all the videos. So if you're new to the channel, welcome. I'm Dr. Khaled Sadek. I specialize in the removal of cysts and lipomas. Great to see so many people already joining in on the live chat. I can see here Prince of Zam, Gibby's wife, Cherry, Dr. Sarah, all very pleased with an unexpected surprise. Absolutely. I thought I would just rejig the system and see how it works. So the first thing I want to do is make sure that the camera is in the right place there, and it's covered by a little beautiful blue square. That's part of the streaming setup. I've got my trusted mic here. Hopefully you can hear me. When I played it in the rerun, there's a lot of distortion sound. So let me know in the chat box if that's still the same. I want to know what else was there. Let's have a look. Let's see where we are. I've got the videos again, so I thought, why not? We can show those and let me know what your thoughts about them. I've also made adjustments to the bottom there. That's the chat box, so everybody can type their names and get seen. So in that bottom corner, it was a weird purple color, and it kind of clashed. We've also got this young man here, who was yesterday's video, and what I've done is I've managed to. I'm going to do the whole thing over again. Okay, for the guys who are watching, we're going to do it all over again. We're going to talk about everything we intended to do it and do it properly. So, number one, we're going to see a replay of the grand unveiling. Now, I've got to be careful when I do this because I've got to be quiet. So this is that epidermoid cyst on the chin, and yesterday we revealed the grand unveiling, and here it is again. Hi, welcome everybody, it's me, Dr. Khaled Sadek, and you've tuned in to my fantastic YouTube channel on cysts. So that's actually the video, the original video. Remember, the epidermoid cyst is there, and we're going to go and take a look at how that looks like after a week of healing, and we take the stitch out and then we get to see the result. So that's the video, it's working. I've cut the audio and I can get back to the audio again. Call me a one-stop shop for cysts, and I remember not to talk all over it. So hopefully that one works. So that's the video we're going to be looking at. So we'll take that away, and then we'll bring in. So what? Not that one. I've got to label them. That's what I need to do. 1, 2, 3. This guy. We're going to be doing.
Right, Rolly?
Fine. Going to do
It's
this.
been a week.
The removal. So I've got to take the audio off here, but what we can see is just down there, we're taking off the plaster. He's kept it very, very dry, very, very clean. Look at that. You can't even see it. If you can see it, let me know. Let me know where. I mean, can you see that? Look at that. We're just taking out. I mean, look at that. Just clip it off. Look at that, it's all gone. Look at that, that's brilliant. Wow, it's magic almost. So that was the grand unveiling there. Also, we've got to abide by all of YouTube's stringent rules about things we can show, can't show. So the virtual clinic is really a place where we can abide by those rules. So in the future videos when we've got reruns of things, we're going to try and remove or glare out things that may offend YouTube, so we don't offend YouTube. So let's have a look at the feedback. Where's that feedback? So what's it like? There's our man. Look at him. He's looking really sharp.
Like magic. like magic. No sign at all. It used to be very big cyst there, very big cyst, large sac, but look at it.
Beautiful, beautiful.
Magic. No sign, no scan, nothing.
Right.
That's beautiful. That's beautiful.
Well,
Perfect.
Thank you, Vic. That's a pretty solid result. You've got to admit, he looks really, really great there. And then, to stop it all off, we're going to re-show you the video from yesterday, the full video. Hi, welcome. It's me, Dr. Khaled. But we'll take out the audio because last time I tried this, I crashed the whole audio because I don't have any headphones. So I'm going to get a pair of headphones so I can listen to what's going on. I've only got a mic and the mic doesn't play the speakers out. So I've got to make sure that the mic is working well. But look, why not? Look, now I can almost do the commentary as we go along, as if it was the video. I can just redo the whole commentary and just practice it. Well, there we go. Let's give it a clean. We've got that chlorhexidine. It's big. It's really big, isn't it? It's just there on the nape of his neck, and you can really see it. You can't hide this behind a collar. Maybe in winter or autumn, you could get away with a scarf, and I've had many patients using garments to hide disfiguring skin lesions like this. And he may have tried a scarf, we don't know, but like, you would need it, but I don't know what you do in the summer, and I think that's why he's done it. So here we go, we're going in, very fine needle, low diameter, and we're just going to put in that xylocaine. You can see as it goes in, his neck is quite pink, flush with blood. When we put that xylocaine in, it's got that noradrenaline, as I've mentioned before. It causes the skin to, the blood vessels to constrict. It blanches, it goes white, and that's what we're seeing here. Little white blanching. There we go. Let's have a look. Wow. Let me know your thoughts of this new layout. Hope it's working okay. So let's put the drape over him. At this point, you can see that my video might be in the way. So we're going to have to somehow work that out. But we can't watch all of it, obviously, because I think we'd get in trouble with YouTube. So we're going to have to not live stream that video. But you can see it's actually a really nice little setup. I think we're going to have a lot of fun in what we're going to be doing. This is a great little setup. I'm certainly enjoying it. Let's have a look. Let's say hello to some people. We've got a lot of people today for an unexpected, unscheduled chat. I might do this more often. Why not just log on and chat to everybody around the world? Let me know. Is 3 times a week too much? Not enough? 7 days a week? Every week? Every day? Every hour? What's the frequency? What is the sweet point for having the streams, for having the live discussions? Let me know. Hit me up. Put your messages on here. Let's have a look. Let's scroll through. Let's have a look what we've got. So what have we got down here? We've got Prince Azam, man behind the cam, Gibby's wife, Sherry, Gibby, Caddy Jackson. Welcome everyone who's new and first time commenting. Welcome Maria George. Welcome Prince Azam. Have you got a new studio setup? We sure have, Prince Azam. Let me know what you think. Belinda from Cologne. What a great surprise. Belinda, thank you so much for working really hard on creating those Instagram stories. If you guys are on Instagram, you'll know that Belinda generously spends her time creating really nice pieces for stories on the videos that we produce. So yeah, big shout out to Belinda and all her hard work for doing that. She does that just because she loves the channel. That's amazing. That's the kind of community spirit that we have going, which is wonderful. Sherry S, loving the sweater. Well, look, I'm going completely casual, so I thought I didn't even know if this stream was going to be. I didn't know it was going to work. So I thought, why not? Let's just go casual. Didn't think anybody was watching. So you caught me off guard. Let's have a look. Sandra Goody from Enfield. Sandra, a regular viewer. Welcome, Sandra. This is new and wonderful, says Caddy. Sharon Lester from beautiful North Carolina. Gibby, why have I always got lost between channels? Look, we're going to get there. It's a journey. We're going to get there together. One live stream at a time. Eventually, we'll have it nailed. We'll know exactly how to log on. There's a lot of tech. There's a lot of a setup here that you can't actually see. We've got lights, cameras over there. We've got so many wires coming out. This kind of setup is really complex. I will tell you what, I'll put a picture on Instagram of this setup, and so that you can see what I'm looking at. and what it takes to set this whole thing up. So let's have a look who else we've got here. We've got Maria George, we've got Bridget Schumacher, Edward Dillian, Princess Am, loving the jacket. Marty, I think we're getting some behind the scene pics. Elizabeth Clark, this is new to me, welcome. Snoopy 2 from St. Louis. Wonder 50, welcome. Sharon Lester, Marion George, Margaret J, good evening doctor. You usually do your live chats Wednesdays. This is going to be a new night. Look, we've got let's bring it up to the camera. Let's see. I don't know if you can see that. That's the setup right now. Thank you so much there for that's the directors just giving me the view behind the scene. So you didn't know it was Margaret saying, really surprised, Thursday night's not like a VC night, but I thought, why not? We're going to try it. Tom Hensley from New Jersey, welcome Tom. Marty saying hi. Let's have a look. Let's scroll through. Doctor, you're a perfectionist. Awesome job, says Bridget. Too kind, too kind. Sherry is saying hi. Sandra Goody from Enfield. Blimey, nice surprise. See you on a Thursday. Where is it? I can't see it. There's no video, but we've got the live chat going, which is awesome. Anne Brooks, welcome. Let's have a look. Wanda saying, looking amazing. Gail Marie Reynolds, that's an amazing extraction. Great fun. Awesome, awesome. Sherry S. Anne Brooke, welcome. Let's have a look. Let's scroll down. Justin Molyneux from England in Yorkshire. Welcome, Justin. And Deb Lepley, loving the videos, along with Bubby. She's saying hi from Paraguay. Awesome. And Melissa from Pittsburgh. And Marion Lynch. And Sid G. And Audrey McDonald. And Christiana from Istanbul. Welcome, everybody, to a surprise live chat. Do you know what? We might have to do these live chats more often. I wonder, the thing about the live chat is you have to have all the material ready beforehand. So what I can do is, should we watch a video together? Now we can do this two ways. We can create a web link, or we can actually, what we can do is we can watch another Pimple Poppers video, and then I can talk through it. Should we do that? Should we do that? And then we can talk through it. I think then we can actually have their material because we're commenting on it. Let's see if we can set up. Give me 2 seconds. Let me see if I can get the web page. Talk amongst yourself while I do that. In fact, let's have a look. So web page, web screen capture. Let's have a look. I'm probably over pushing myself on this, but I give it a shot. Bear with me. I'll tell you what. There is an intermission button we can press, but we won't do that. So video capture device. I think it's display capture. Let's put web. We can add that on. No, we don't want that. That's ruined it. So let's undo that. We don't want that. Undo that. That's not what we want. We need to work out another way. Are you all patient enough for me to do this? Okay. All right. Let me try one more time. Let's have a look. So, display capture maybe. A secondary monitor, primary monitor. A scene. Oh, browser source. I think I may have found it. Browser source. Let's have a look. Browser source. Add. And no, it's not going to be the browser source. That's not going to do it. The easiest thing to do, maybe we'll have to schedule that for another night. Instead, what I can do is look at a video that we've done before and then comment on that, because then it's kind of educational. You know. So let me see if I can pick one of my favorites, and then we can watch it together in a proper sort of popaholic style. That'd be fun. Hope you're not all untuning while I do this live. Let's have a look. Oh, do you know what? Let's do this one. Yeah. Let's do this. Yeah, so this, if you don't know, which I'm sure you all know, is a is a video of a gentleman who presented with an epidermoid cyst. It's the sister video to the unveiling, and that's where we opened it and we were completely gobsmacked by what we saw inside. I think you've worked it out. I don't think I need to tell you anymore, because what we found inside was more than just cyst. It was more than just sebum and dead skin. There was something else. For those of you, I'm sure everyone who's watching has seen it. It was the hair. Had lots of hair in there. So, should we watch it together? Why not? Why not? Let's have a look. Also, we did the introduction there from a phone box on the Thames. That was a suggestion from our viewers. They wanted scenes of London, so why not the big wheel behind me and the phone boxes as well. Let's go. While that's cooking, let's see what we've got in the chat box. Paraguay, we got two, so we got to Bubby. Melissa from Pittsburgh is saying hi. Man Cave says Bridget Schumacher, or Man Cave screams Bridget Schumacher. Marianne Lynch from Ireland. Audrey McDonald from Northumberland, welcome. And we mentioned Christiana from Istanbul. Sophia K from Greece. Why is it stopped? Victoria Myers, she's loving the video. The blue cats, cherries, welcome. Rita Pam went to check on baby giraffe, and there you were. Wonderful. Look, there he is. He's lying there. We've got the twin cam here as well. One of my favorites when we can get the team in there. We've got the twin cams. You get loads of different angles so that when one is covered, we can switch to the other. And the cameras we've got in place now are really, really high definition. The latest tech we're putting in. Really nice technology to get you the best pops. And you can see that is an amazing lens, and it's really zooming in, and the picture quality is maintained. So really proud of the camera team working on that. Let's have a look who else is in the house. Anne Brooks. I love Dr. Sadek and his spontaneity. I tell you what, Thursday night, it's a school day. We shouldn't be on too late, but we've got it. Let's have a look. This is fun, proclaims Gibby's wife. Let's have a look. Oh, he's going in for the cut. What is going in for the cut? Let's have a look. Oh wow, look at that. So you can see the hair straight away. You can look and you see it. I can't look. I think I just thought, what is that? And I actually thought initially, I thought it was suture material that had been left behind from the last surgeon, because there's a guy who had it operated on twice before. But actually, you know, as we know now, no, it wasn't. It was hair. Sandra from Enfield is saying hi. Gibby's wife Rebecca, I have nothing. This is a good one. Audrey McDonald. Cherry says, if he can cook, we're all going to start fighting over him, taking him home. Sandra Goody from Enfield, welcome. Kelsey, it's 4 p.m. in Florida. Wonderful. This is a good one. I always enjoy the work. So, my face is in the way. Shall I move my face to the other side? I think we will on this occasion. Should put me down here. Put me down here along with this. Wow, look at that. Gosh, there's that hair coming out again, isn't it? So, oh, so much content, isn't it? There's so much stuff in there. And so much hair. A lot of people asking, how did the hair get in there? I suspect when they did the first surgery, something must have kind of just snuck into the wound and then just grew. And as it grew, it kind of curled and curled. And that's why it was right actually on the surface of the cyst. When we opened it, do you remember? We saw the hair. So it's like when they did the first incision, when they did the first drainage, you know, stubbly man, hair went into the wound and then just grew. And maybe a couple of follicles went in there. And that's why I suspect we've got the hair inside. Typically, you wouldn't see different elements of tissue inside a cyst. You know, if you start seeing hair and bone and skin and teeth inside a cyst or a teratoma, it's not a good sign. Sometimes, you know, ladies, they get these kind of cysts and you can find like teeth and stuff inside it from embryonic development. You know, you're born with these things, these teratomas that kind of just grow out. This looks like the last, oh, that was a long one. You can make a wig out of this one. Straight in there with a replay. Let's have a look. Let's go back to the chat. Let's see what's going on. This is a good one. I'm always enjoying the work, says Miss Taylor. Kelsey, it's 4 p.m. in Florida. Let's scroll down. Sarah Sims is amazing. Morris from Arizona, how are you doing? Joyce Bauer, is there a reason for offset syringing when injecting? What do you mean? Tell me more, Joyce. Rebecca, I am not paging anything. Not sure what that means. Carol, how are you doing? Why many hairs? Why many hairs? Absolutely. We were discussing that, haven't we? Joey C says, what's up, man? I'm in Bozeman, Montana, loving your videos. When mammy hair loves daddy hair, they move into a place together under the skin. That's it. That's how it works. Forget about the birds and the bees. It's all about the mummy hair, the daddy hair moving into a cyst. Snoopy is hi from St. Louis. Tara Dorfman from Long Island. Pop it, will you? Cries Carol Reisinger. Welcome. Wonder 5. Loving it. Julie B. It's like a twin that didn't develop. Yes, exactly. It's like almost like a twin that didn't develop, but that is actually that's an embryo. The other ones are not embryos. Kelsey, so if you flip the skin out, you see the other hair follicles. Yeah, exactly. Pirated Lady 45 from Rhode Island. Sue Bailey, how are you doing? From Scotland. Bruce Davis from Portland, Oregon. Laura from Utah. Sheila from Philadelphia. Welcome. And Carol from Arizona. How's everybody enjoying this? I think it's great. Let me know. Tucking in. 22 minutes. I'm not sure if that's working, that chatbot thing. I'm not sure how you like it there. I'm kind of struggling with the font, with the colors. It's a bit garish. You need to really let me know your thoughts. And if you're an expert in Streamlab OBS, let me know what I'm doing wrong. But I love how you can just insert videos, you can do the commentary, you can do lots of other things as well. So it's going to be very, very versatile for our virtual clinic when we cover lots of different topics. So that's great. And look, back here, you still got some of the old, remember the old days when we used to do it, when I did it on my phone? You can see all of that kind of stuff. So that's a homage to the old days. And also got a really new, comfortable chair. I can kind of swivel around. And people were complaining, we can't hear you, we can't hear you. Now I've got a microphone. So I'm like radio presenter. Hi, welcome. Oh, sorry. I should have touched it, break it. I'll put that back. So look, we're going to do some blunt, we're doing blunt dissection here. You can see just kind of just separating the sac away from the skin. So blunt dissection is really important when you think about tissue handling. You don't want to kind of go in with a pair of scissors and just cut like that. That causes a lot of trauma, a lot of inflammation, a lot of scarring. And can cause pain in the future as well. Let's have a look what people are saying. Loving it. Let's scroll up. So where were we? We've got Portland, Oregon. We said hello. Philadelphia. Carol. We've got Carol from Arizona. Sarah Sim. Welcome. Kelsey. Can you show us sometime? Absolutely. Ella from Israel. Welcome. Shalom. Bruce is saying this is a great video. Sid G. Loving it. From Utah, we've got Angie. Laura is giving us rainbows, but she's from Texas, and it's pronounced Saxi in Texas. Great name. And we've got Dawn. She's loving the videos. We've got Richmond. We've got Gino from Richmond. We've got Wanda. So many wonderful people. And there we go. We're putting in the final stitches. Remember, if you're new to the channel, welcome. Don't forget to subscribe, press like, leave your comments down below. The more comments you put in, the bigger the channel will grow, the bigger our community, the bigger our pool of friends, the bigger our viewer. So just put comments, blah, blah, blah. Hi, let me know what you want to see. If there's any particular favorite videos you want me to look at and discuss, let me know. Put it in the comments. You want me to look at any particular surgeons that you think are doing a really good job or doing a really bad job and you want us to look at it? Let me know and we can put it all on this amazing platform. And I'm just going to put some subcuticular stitching. A lot of people wondering what's the difference between instrumental, let me move this, instrumental suturing and hand ties. So I do the surgical knots, which are thrown by hand. Then it looks like you're tying your shoelace. It's a little bit more complicated than that, as each knot has to be thrown in alternate directions to the previous, so it locks, and it takes years of practice to kind of get that surgical knot down. Instrumental tie is kind of like you just do this kind of, I don't really like it. Much more fluid with the surgical knots, and just put them in there, and it saves a lot of time. And that's a subcuticular stitch, really nice, clean scar, as we saw in the unveiling. So look, guys, it was awesome. I didn't think so many people were going to catch me today, and it was a real treat to have a chat with everybody. I hope that the audio is working well, the videos are working well. Let me know your suggestions. We've got another chat tomorrow, and I've got material for you as well. So thank you all for tuning in. Let me know your suggestions. Remember, hit the like. If you're new to the channel, welcome.